Do you feel something on the other?
Just a little bit tightness.
Okay, do you feel some tightness when you go? Good. Yeah, let me check again. Now, so he feels a little bit tight, but I think he has more range also on this side. So maybe it's the stretching range because he has more range to the left than to the right. I don't know if you can see it. Would you like to sit and sit together? So here, it's, as a person, he likes to have a lot of upper cervical side flexion, and he doesn't like a lot the lower cervical side flexion. Yeah? But he is somehow trying to put the lower cervical to the left. If we go to the other, he is going too far on upper cervical flexion. You can see it's the chin movement. So we have two types of flexion. The one is the upper cervical flexion, and we have a lot of range. And the lower, it's stable, doesn't do nothing. And then we can add up the lower cervical flexion. And for me, this is a little bit stiffer, a little bit. But he has more pulling on the right, so we can check it out. Good. Now, can you please lie down? So if you have a person that he has some arm symptoms, you must run a neurodynamic test. And also you must do some neurological assessment. So there are two things you must do. So let's start from this before we do anything treatment, because you don't know with what you are dealing with. You know, it can be another problem. Yep. So, yes, first is sensation. You must test if sensation is okay. Yeah. And its strength, to do all the strengths, all the muscles that are working. So this is the contraction test to be sure all muscles are working, sensation is working. You can do some, reflex test, whatever. It's not the first priority, but you can also add reflexes. So this is the one that the nerves are conducting. And then neurodynamic tests are testing mainly if the nerves are more mechanically sensitive. So when we put load on the nerves, they are overreacting with symptoms. Yes? So we test the mechanosensitivity of them. And like trigger points, which we are using palpation, compression as a provocative test, the same we do for neurodynamic tests. We try to overstretch a nerve in order to give symptoms. Yeah? Now, if you have pain on this arm, you never start with this arm. You always start with a good arm. You do the test first to the good arm, and then you compare it with the one you have the symptoms. You never start from the arm has symptoms. So in order to stretch a nerve, you must visualize his anatomical course in a way. So if you like to think about the brachial plexus, it goes out between the scalene muscles we are going to palpate, and then goes below the clavicle here, and then the nerves emerge in the arm. Let's say we go now for the median nerve. So it goes inside the arm, yeah, on the anterior part of the arm, and then in the anterior part of the forearm, and then it's spreading to the fingers. So if you visualize, you grossly have an idea of how to stretch it. So how to stretch it, the one is to bring the head, side flexion, so you have elongation. You must bring the scapula in depression, and you must, by keeping the scapula on depression, having some elbow wrist extension. So you have a pulling sensation on the median nerve. However, we don't do it randomly. You must, in order to be able to reassess and also to communicate your data with other health professionals, you must use a standardized test. Yeah, so we can do the standardized test of the median nerve. Okay? Good. So the first thing you should do, never start with this arm, you must start with a good arm, is to find a neutral position for the scapula. So if scapula is on elevation, that's a lot of room for the nerve, and the nerve will never be stretched. So you like to not have elevation, but you don't need to be on depression. That's too much for the nerve. So you just go to the middle range, to the normal range. What you are doing normally is you are going from elevation to depression, and you stop in the first resistance. So you don't stop in the second resistance, so you are in full depression. You are stopping in the first resistance. So I'm deloading the arm with my left arm, and I'm finding with my thinner what's the first resistance by going in scapular depression. So the first is to find the first resistance, and if it's here, then I'm pressing my fist towards the bed, and I'm pressing the bed like I'm punching the bed, like this. And I keep my wrist totally stable, because if I do wrist flexion, he will go again in elevation, so I must be really straight. Then, if I have a normal shoulder range of motion with my body, I bring the shoulder in 9 degrees of abduction. And you must adjust the height of the bed so to be able to support the arm of the person with your leg. Now it's a little bit high, so I'm using a little bit of dorsiflexion in my foot. Then the next step is to go to the hand and find some wrist extension, finger extension. And you can see with my index, I have the thumb out. And then I'm taking the forearm supination. The next step is to go to glenohumeral external rotation by keeping the wrist stable. And the final step is to have elbow extension.
Yeah.
So with words, tell me what you felt with words. Don't touch something, just explain me. That's the process. He must tell me with words.
Just
Nothing?
yeah, nothing.
Let's have a little bit of more shoulder depression.
A little bit numbness. Yeah.
Where? Good.
Here.
That's a normal reaction. And there
Normal.
it's leaving. Now, we don't know when we do that if it's a muscle pulling, because now I'm stretching the flexors of the forearm, or it's a nerve. And it's only one way to make the distinction between muscle and nerve. And this is called structural differentiation process. And this we do it with a head. So the next time I will do it, I will ask him to do this, and you must train the person to do it. It's not easy to teach it by verbal. So you must take your head, lift your head, put your head to the side, and put it down. If you don't teach it, people do this. Yeah? So lift the head, go there and down. So when he is going to do that, if the pulling will go up, it's a nerve. If the pulling stays the same, it's a muscle. Do you feel something?
Sure.
Do the head thing, slowly. More? And back? Less? Yeah. So it's a nerve.
No.
And show me now what you felt. What you felt?
지금 어때요?
Where? In which area? Show me the area. Yeah? Good. So this is normally, it's not a positive test. It's a normal reaction. When it becomes positive, when it reproduces the symptoms of the patient. So everybody will feel something because you are stretching a nerve. You will feel a pulling. It's okay. If it reproduces your symptoms, it's positive. Also, if it's totally different than the other side, it's very restricted, it can be partially positive. So it's interesting. But the pulling itself doesn't say nothing. Okay? And if the head is moving and this gives tension to the nerve and the pulling is the same, it's muscle pulling. It's not nerve pulling. Okay? Let's do it.